Chris Hayes here from Hayes Physical Therapy in Paoli, Pennsylvania. Today we're going to talk about a couple exercises for sacroiliac joint or SI joint correctives for pain that you might be experiencing on one side of the buttocks. Oftentimes this will wrap around like a horseshoe from front to back, and sometimes it'll even grab the sciatic nerve and go down the leg. So it's one of the common causes of sciatica, actually. And usually it's caused from a direct fall to one side or another. Women in pregnancy can get SI rotational problems because their body is getting ready for birthing, so their ligaments are really soft, and they're carrying 8 to 10 pounds in front of them, so things get thrown off kilter. So direct fall, pregnancy, or men used to get this all the time when they would put their wallets in their back pocket and they were sitting and driving, and it was actually forcing their SI joint out of alignment. So if you have sacroiliac pain and you've been told that that's the main reason why you're having pain that's grabbing you like a horseshoe or going down the leg, a couple correctives that we can do to show you how to fix this. Obviously, you want to know the root cause of your sciatica, and a comprehensive physical therapy evaluation is really my first preference so that we can tease out, is this an SI problem? Is this herniated disc or bulging disc issues, or is it stenosis? Because we don't want you doing the wrong exercises. But having said that, if this is an SI issue, I'm going to show you a couple correctives. So Tyler's going to lie on his back for me. Bend both knees up for me. So the sacroiliac joint is your pelvis, and when somebody has a sacroiliac rotation that's out of alignment, even though the pain may show up on one side, it's actually an unhappy marriage between the two pelvis. So we're going to do a correction that's going to involve both sides of the pelvis. When we see a patient like this, a lot of times their one leg might be longer than another, because again they're out of alignment, and we click these guys back in and it stabilizes them, and then we stabilize the core. So first exercise I'm going to show is, I want Tyler, bring your right leg up and put your right hand behind, and then bring your left leg up and put your left hand on top. So one hand behind, one hand on top. And then what he's going to do is an isometric corrective, where he's going to try to push down into his right, down into that hand. So down with this one, 1, 2, 3, 4, 5, and up with this one, 1, 2, 3, 4, 5. Not at the same time, so one at a time. So right goes down, okay? Left goes up. It's going in the direction of the hands, okay? Right pushes down, 2, 3, 4, 5. Left is pulling up, 2, 3, 4, 5. Right down, 2, 3, 4, 5. Left up. It can be a little tricky, a little confusing, but you're following where your hands are placed, and you'll do about 10 of those, right? And you shouldn't have a lot of movement. It should just be the hand kind of blocks, and you're just pushing down into it, or you're pulling up. So after you do about 10, then we're going to switch it up. Put the right hand on top, we're going to get really confusing, and the left hand on the bottom. Follow where the hand is. Pull up, 2, 3, 4, 5. Push down, 2, 3, 4, 5. Bring it up, 2, 3, 4, 5. Push it down, 2, 3, 4, 5. Up and down. And he's doing about 10 of them. It's almost like a little running man. Okay, so that's one exercise, and then nice and easy, put the feet back down. Then we're going to actually put a pillow or a bolster between the legs. I'm just going to grab that. And so now we're going to put this pillow between the legs, and all I want you to do, Tyler, is while you have your core engaged, I want you to pull in against this particular guy, 1, 2, 3, 4, 5, and then relax. Give me 10 of these. So the pelvis, not only can it rotate front and back, but it also is connected to your adductor muscles in the front of your groin by way of the pubic bone, and then also your external rotators. So right now, Tyler is just activating those, and sometimes you even get like an audible pop when that thing pops back into alignment. So keep going with that one. And in addition to the adductor squeeze, I'm also going to have you do a little belt work. So keep going. Okay, so that is the adductor squeeze, And then at home, you can tie either a really tight piece of TheraBand around the legs or something more rigid like a belt, okay? And then what I want you to do now is go the opposite direction and push out 2, 3, 4, 5. That'll also work that sacroiliac joint. Core is on and he's pushing out 2, 3, 4, 5. Continue out 2, 3, 4, 5. So this is an abduction, isometric, great. Maybe about 10 of those. And then if this happens to you and you're at work or you feel stuck when you're in standing, we're going to do that same little corrective in standing. So come up to standing, Tyler. And so I want you to put your right foot in front of your left. Good. And so just like you had the hand behind the back and the hand in the front, okay, but you don't need to have your hands there. The direction is as if you're in glue. You're pulling the leg backward into the back of your shoe for 5 seconds on the right leg, and then you're pushing forward towards the front of your shoe on the left. So it's a pull back, 2, 3, 4, 5, and then a push forward, 2, 3, 4, 5. A pull back, 2, 3, 4, 5, a push forward. Okay? It's doing the same thing that we did before. Can you feel that?
Yes.
Good. So you'll do like a set of 10 this way, and then switch feet. So now, foot in front, pull back, 2, 3, 4, 5, and then the rear foot forward, 2, 3, 4, 5. Don't twist your pelvis. Back 2, 3, 4, 5. Forward 2, 3, 4, 5. And you'll do like 10 of those. Okay? Same thing we just did on the table. Then put your feet next to one another. Pretend you have that imaginary pillow between your legs and just squeeze in 2, 3, 4, 5. And then relax. Okay? In 2, 3, 4, 5. And then relax. These are great sacroiliac joint correctives. Again, if you're experiencing pain in that hip area that wraps around front to back or pain down the leg, my first recommendation is to see a physical therapist to rule out hip issues, hip pathology, sciatica that could be coming from a herniated disc, and also sciatica that could be coming from stenosis. Because we know it's really important which exercises you do so that you don't make the condition worse. You want to make sure you're treating exactly what needs to be treated. So thank you so much.